basically what I'm going to be talking about in my meeting, in this session, is really the future of transplantation enabled by bioengineered organs, namely the liver, which is the organ that I've been working for in the past 13 years. And basically what I'm going to show you is that we can use discarded organs for transplantation, that we can decellularize, or basically all the cells away, and then recellularize with the cells of a patient. And then by bioengineering techniques, we're able to generate a new liver that hopefully in the future will be amenable for transplantation, and will be able to then rescue the liver function that the patient didn't have. So this is, I think, a direct proof of what we design and what we believe is regenerative medicine. And this is the way we believe that things will happen in the future, particularly considering that nowadays we have a huge organ shortage, and also by the use of immunosuppressants as we have them today. If you have autologous organs bioengineered in the lab, it can certainly save 2 or cure 2 diseases. First, the immunosuppression, and then the underlying hepatic disease. And this is what you can listen to from the session that we're giving at this meeting. Some of the things we suggest, and that, we talk a little bit about the challenges in the talk, the organ shortage, cell issues of how to do large-scale cell expansion, how to do vascular networks in vitro, which is still probably the biggest challenge to make bioengineered organs a reality in transplantation. So all those are covered in the talk, but going a little bit into more detail, some of the things we have dedicated quite a lot of time and thought in the last years have been directly related with 2 aspects, or 2 big challenges here. So the first one is large-scale cell expansion. So if you just consider the sheer number of cells that are needed to bioengineer a new human liver, which range in about 120, 150 billion cells, so you certainly need to have very robust platforms to be able to give you these types of numbers. The second biggest challenge is that once you transplant these bioengineered organs into a patient, the vascular network that you have there needs to be working 100%. Otherwise, there's a risk of thrombosis, and you're going to be losing the organ and putting the patient in peril. So this is the 2 main issues that we've been working quite a bit, like I said, in the past years. And for the first, the cell expansion, we've been working in collaboration with the University of Utrecht and the University of Lisbon, with some collaborators there, to be able to do large-scale cell expansion of human liver progenitor cells that we were able to isolate from a biopsy from the liver of the patient, and also endothelial cells, vascular cells that are dearly needed to be able to revascularize all the vascular network of these decellularized scaffolds. So the next thing we've been working also quite a bit is what do we need to do in the lab, in the bioreactors, to then create a new vascular network. And in this regard, one of the things we're going to be discussing in our talk is what are the pressures, what are the conditions and the growth factors, and also the combination of cells that is necessary to reestablish from zero a vascular network that can cover the large diameter vessels to the micro diameter vessels, and so basically recreate the whole vascular tree, so that once we transplant this, blood will be always be enclosed in vessels with endothelial cells, with muscle cells, with mesenchymal cells, rather than going through channels that might activate the clotting cascade and then thrombosis. So this is the 2 main challenges that we're going to be covering, and that are also the biggest challenges I think we face in the field of organ bioengineering. Once we solve this, I think we're going to be in a good shape to then see this going into transplantation.